They handed me my newborn baby, and the first thing I thought was, wow, I'm so lucky. And the second thing, wow, he has a really bad tongue tie. Yet later that day, when the nurse practitioner was examining him, she said, I don't think it's that bad. And I looked at her and I was like, really? I'm Erin. I'm a pediatric nurse practitioner and lactation counselor. Make sure to hit subscribe so you can feel good about feeding your baby. Tongue ties are actually pretty controversial, and I'm here to talk to you from a unique perspective of a parent who has dealt with a baby with a very bad tongue tie and a lot of issues resulting from the tongue tie, and a medical provider who is actually the one diagnosing a tongue tie. If you're sitting here wondering, does your baby's tongue tie matter? And if it does matter, then what do you do about it? How do you decide if you see a pediatric dentist or an ENT? And then what happens after if you decide to get a revision? I'm here to answer all these questions from the perspective of lactation and also as a medical provider. A tongue tie is a little band of tissue that most babies have underneath their tongue. The problem is not actually the tie itself and that the tissue is there, but the problem is when that tissue causes restriction or it impairs the function. So if it's too tight, babies may not be able to breastfeed properly, or they might not be able to get milk from the bottle. That was the case with my son. The tricky part is that your baby can have a tie that looks really severe, but there's no impairment of function at all. Or your baby can have one that doesn't look very bad and they're still having trouble with feeding. Like I said, many babies have tongue ties and many adults have tongue ties. Once you're trained to look for it, I see tongue ties in a lot of people that I know when they're having conversation, and I have one myself. So I'll show you this little band of tissue so you know what to look for in your baby. It doesn't always look like that, but mine is more on the mild to moderate side when sometimes it's more moderate severe. And like I said before, it really matters what's happening during a feed, not necessarily what it looks like. How do you know if your baby's tongue tie is actually a problem? I'm going to break it down. So the first thing that as a lactation professional I see all the time is latch pain or discomfort when latching. So parents are doing all the right things. Their mechanics, their baby is in the proper position, but their baby really has a hard time with a deep latch and goes really shallow. So maybe sometimes they start off deep and they go shallower, or they can never really get that good deep latch. Your nipple might be coming out compressed, or there might be a ridge, so it might look like a lipstick. You might hear clicking. Your baby is not getting a good seal. They might be very gassy or uncomfortable or become unlatched when you wouldn't expect them to be. The second thing is milk transfer. How much is your baby actually getting at the breast? So if you're feeling like there's any concerns with your baby having a tongue tie and they're not gaining weight, they're not having good wet and poopy diapers, they seem to fall asleep immediately at the breast, they tire out really easily, those are all reasons why we would want them evaluated more. Milk transfer is not always the best indicator because sometimes babies are getting enough, but they still have impaired function. That was the case with Elliot. He was actually gaining okay in the first 6 days of life before we had his tongue tie clipped, but he really did have impaired function, and I know that because I watched him feed all the time. So sometimes it just takes somebody looking to see how the tongue is functioning during a feed to know, is this a problem or is this something that maybe we can watch and wait? The third thing I see is problems with mom. So mom might have recurrent mastitis. She might feel like there's milk being left in the breast, clogged ducts, anything to indicate that milk is not being removed properly from the breast. So it's not necessarily just one of these things, but it's sort of the whole picture. Maybe you've noticed some of these above. So how do you decide if your baby's tongue tie actually needs to be clipped or taken care of or not? This is the controversial part about tongue ties. So there are a lot of very strong and differing opinions about what you should be doing about tongue ties. There are some providers that will say no tie is a good tie, and there are some providers who will say tongue ties are overdiagnosed and overclipped and people just want your money. What I'm concerned about is there issues with baby's function and with how the tongue moves and how they eat. When we talk about the weight side, it's when babies have a tie, but their function is not impaired. So when they're eating, mom is comfortable, you're able to get a good latch, baby is gaining weight well, they're able to remove the milk from the breast, they're having good wet and poopy diapers, they can move their tongue in all the ways that they're supposed to. They can move it past their lip line, they can move it to the left, to the right. The tongue sits on the roof of the mouth. It can get to the roof of the mouth up to the tooth line. And if all of that is happening, yet your baby has a tongue tie, I would be reluctant to do anything unless there's an issue. And now the treat side. So if your baby has a tongue tie and they're having issues with weight gain, they're really gassy because they can't hold a seal, your milk supply is going down because they're not actually removing milk from the breast well. If you are trying all the positions but you can't find something comfortable or your baby can't get a good deep latch, that's when I recommend you find a provider who knows something about breastfeeding and can do a functional evaluation. So sometimes this is a pediatric ENT, this might be a pediatric dentist with breastfeeding experience, this might be a speech language pathologist or physical therapist, but somebody who knows what to do and what to look for, and if there's anything that can be done before they actually have to do the invasive procedure of the clip or the laser. Now, I want to be clear about something that I see on social media all the time. Having your baby's tongue tie revised is not a magic switch to mean that everything is going to get better in your feeding journey. And while sometimes they're severe or extreme cases like my son's, you still need a provider that can give you guidance on what to do after the tongue tie revision, or if there's something that can be done before the revision that will help your baby feed. You've decided that your baby needs a tongue tie revision. You've talked to all of your providers and gotten all the information. So who do you actually see to do the revision? And I will say this is for US only, this part, because other parts of the world, you may not have these resources, or there might be other providers that do something a little bit differently. It can get a little bit confusing because different providers look at things in a different way and take different approaches. The main people that I see ending up doing tongue tie revisions in the US are often either pediatric ENTs, sometimes plastic surgeons, or pediatric dentists. So the ear, nose, and throat doctor will often numb the area a little bit. They use sterile scissors and they cut the tissue with the scissors. There might be a little bit of blood, but it takes roughly 2 minutes, and then your baby is usually there nursing right afterwards. So it is the least invasive way to treat the tongue tie. Elliot had this at day 6 of life, and I was very nervous. They literally took him away, and I actually wanted to watch, but by the time I actually got my stuff organized and went over to him, it was already done. Then he nursed immediately afterward. The second option is a pediatric dentist, and they usually use a laser, and they go in to cut ties in the back. So it's not just the tissue in the front, but it's also the ties in the back. The actual wound afterward, I'm not gonna lie, it looks pretty gnarly and it seems painful. We needed to give Tylenol. Elliot, I think, was about 6 weeks old when we got it done, and he needed Tylenol pretty much around the clock to keep him comfortable and keep him nursing. So it needed to be done because he still had a lot of issues after the first tongue tie revision, but it wasn't an easy thing to do. There isn't one right answer of who you should go and see. So what I like families to do is get a lot of opinions. So talk to your pediatric provider, talk to your lactation professional, get their opinions on what does the function look like, and then find a provider to clip it who has experience with breastfeeding and can also do that functional assessment. So they're not just saying, hey, we're going to clip it and then we'll see you later, but they're actually going to be able to tell you, this is what we're looking for in function. I want to watch you feed your baby to see what's going on with the tongue so you can decide, is this the right approach? If it's not the right approach, what are we going to do next? What are we going to do before? And what are we going to do after? If you've made it this far, Let me share what happened with Elliot. He was born with this terrible tongue tie, and at day 6 of life, we clipped it, and he was not able to hold any tone in his mouth. So he was not able to make a seal around the nipple. He could not breastfeed. He could not bottle feed. So we were putting milk in his mouth, and he was pouring it out of the sides of his mouth. So the tongue tie was actually holding tension in his mouth, which was a good thing. And then we clipped it, and he was not able to eat. So this is, of course, a medical emergency, but being a nurse practitioner in lactation, I have a lot of resources. So we saw a great lactation professional and seeing the right types of professional to help him regain tone in his mouth. So we ended up in feeding therapy with speech language pathologist. He ended up still, after being evaluated by multiple professionals, needing that second tongue tie revision. And when we did that, we went with a pediatric provider who had a lot of experience with breastfeeding babies, who did the functional evaluation before doing the clips. And then we ended up back in feeding therapy afterward. So sometimes it takes a lot, even for a professional with a lot of experience. And I'm not trying to scare you into doing one thing or the other, but if I can leave you with one takeaway, it's that it's really hard to figure out. My first son, he has this mild tongue tie and was able, we had a lot of hiccups in our feeding journey, but ultimately he did okay, and I don't think it impaired function at all. My second son had a very severe and extreme case of what can happen, but it really was enlightening. So what I learned is that he needed more help. He needed to relearn how to use his jaw, how to use his tongue, how to actually suck, and how to actually swallow. Here's what I want you to walk away with. A tongue tie is about function, not just how your baby's tongue looks. We revise when the function is impaired, and that is evaluated by a provider who knows what it should look like when a baby is feeding. And that's a decision for you, your pediatric provider, your lactation professional, and whoever's doing the procedure to determine. And in 3, you should see if there's anything that you can do before the procedure to see if the procedure can be avoided. And then if you do go through with the procedure, afterward, you have to see, is there anything extra we need to do because of tension or anything else that's going on in your baby's body that might be still making feeding a little bit more challenging. And I would say trust your gut versus trusting what you are seeing on the internet, because there is a lot of confusing information out there. Talk to medical providers that you feel comfortable and confident in. Talk to friends if their babies have had revisions and see, did they like their provider or not, and find somebody who specifically knows about breastfeeding, what to do before and after you actually get the procedures. I hope this is helpful. Make sure to hit subscribe. Bye-bye.